All right, so today our presentation is on veterans and their biases with healthcare, their desires for healthcare, how healthcare affects them, because these individuals have served our country for so long and have done so much for each of us. And a lot of times they aren't taking full advantage of the healthcare, and healthcare is unaware of the best ways to help them. So this presentation, we're hoping that we can kind of explain the best ways to go about it and how best to help them.
So we were able to interview a very kind little gentleman who served in the Army during the Cold War and the Gulf War in the late 80s to the early 90s. And so most of this presentation will cover a little bit about what he experienced after being discharged and just some general things to know about veterans in general after they are discharged. Is a lot of them experience similar challenges, which we'll go into later on. And there are these facilities called the Veterans Administration, or the VA facilities, and those are meant to treat veterans and cover their health care, that which can lead to some problems and challenges, even though it has great intentions. But a lot of these challenges tend to come from because there's a lot of veterans, and there's a lot of issues as far as health goes with them.
So these individuals who are part of the VA, the way that they handle the prioritization of who requires the most healthcare first, I guess, is they separate them into categories. Category 1 is about 50% or more debilitating disability per person for that individual. So if they're in that category, they usually take priority because their life is 50% or more debilitated based on their service and what they were able to do for our country. So that's category 1. Category 2 is 30 to 40% debilitating, and following that is category 3, which is 10 to 20% debilitating. So based on which category they fall in is a priority of how they receive health care from the VA, which can be kind of frustrating if you're one of the category 3 and you're wanting help now. You sometimes have to wait a little bit for your health care to be done.
So, veterans' view on health and wellness. So, as we were talking with our gentleman, our veteran, he talked a lot about how when he was in the Army, specifically, mental health wasn't regarded as much as it is now. And an example of that was after he was discharged from the Army in the late 90s, after the Gulf War. He was almost deployed back out, and when he was almost deployed, it is required that they get screened for PTSD and mental health. So that is just one huge example of how the military's view on health and wellness has really shifted during those years, is they tend to view mental health as a higher priority now.
Some different preferences that we can do for the health assessment that the veterans said we need to address more is mental health screenings. A lot of individuals who have served in the military do not get addressed for their mental health like they should. There's so many different things that can go wrong with mental health, such as PTSD, depression, anxiety, suicidal thoughts, OCD, various things that being in the military and seeing so many different things that we can not even possibly imagine can have on their mental health. And as such, because these individuals are tough and gruff and they're amazing at what they do, they probably don't regard mental health to the correct level that they should. It's not a sign of weakness. It's not a sign of anything other than they have experienced hardship, and we can help them with that. So making it not a taboo. It's not something to be ashamed of at all. Another preference that we have for health assessments is physical, things such as respiratory, cardiac, and various extremities. Something else that needs to be addressed and assessed is the sexual abuse that sometimes has the tendency to occur in military, especially for our female veterans. A lot of sexual abuse and sexual harassment does happen in the different branches of the military. Substance abuse is also not addressed a ton. A lot of times substances are used to cure, not really cure, but ease the mental health issues that are having, and sometimes that leads to a bigger issue. So just addressing the substances and how they're playing a role into these veterans' bodies, and then better ways to handle the stresses that they have every day based on their service.
Okay, and so here are some just interesting facts about this population. So one of those facts is that suicide, and well, these are not fun facts. These are facts to be aware of. Suicide is the second leading cause of death among veterans, which is huge. So we definitely want to screen for that if you ever care for a veteran. And another fact is that veterans account for more than 9% of all adults experiencing homelessness. So homelessness is a very big issue among the veteran population, and about 10% of veterans have been diagnosed with a substance abuse disorder. And this particular fact was actually something that the gentleman we interviewed talked a lot about, because a lot of things that, or a lot of challenges, I guess, that soldiers face when they are discharged after the military is they don't feel like they have any meaning, or they don't feel like they have any purpose, or they feel guilty for whatever reason, or they were discharged dishonorably, maybe because of a DUI or something like that. But they tend to experience a lot of depression, and that depression often leads to substance abuse disorder or alcoholism. So that is an important thing to screen for. And also, this was touched on by McKenna, but a lot of female veterans do experience sexual harassment in the military. So that is something to screen for.
So some inequalities or health disparities for these veterans. This is something that our veteran was saying, is that healthcare is not super highly inclusive of veterans, and it is often hard to receive the assistance that they need, especially even at a VA hospital, when that's the whole point of the VA hospital, is to be helping them. But based on their different categories, the different severities, it's really hard to get appointments just because of how busy they are with so much going on. Some things that I was reading says that women and other races of veterans receive unequal health care. That's just due to sexism and racism, which is never acceptable. Approximately 90% of veterans don't use any form of health care, including the VA, which is provided to them. This goes back to the fact that they think they're okay, they're fine, and they're not taking full advantage of the benefits that are given them after they become veterans, after they retire from the military. They can sometimes wait months to even years to receive health care just because there is such a need. There's so many people that are needing the VA's help that it's really hard to get everyone to go around. Something that we don't talk about a lot is that the families of veterans can have health challenges caused from the military. Things like they can even experience post-traumatic stress based on their loved ones and things that maybe have happened to them, or if their loved one had passed away. Other things that occur are genetic disabilities that are caused by different conditions that were in the war. Things like Agent Orange can have genetic disadvantages for the offspring of the people that were affected by Agent Orange. So those are just some things to be aware of, and usually the family of veterans don't apply for they can't apply for the VA. The VA is not as applicable to them. So that's just something we need to address for the future.
Okay, perfect. And then some potential biases that maybe nurses or healthcare workers or just people in general might have is you need to be aware that just because somebody may experience PTSD, it doesn't necessarily mean that that person, or in this case, that veteran may be mentally unstable. So that is just one thing to keep aware of. And it was mentioned previously that a lot of homelessness is a big issue among veterans, but we should never project that onto any veterans that we meet. And also being physically disabled, even though that does happen, we do not want to assume that physically disabled patients are veterans, and that veterans are also like uptight and rigid and mean. They, at least in my experience, a lot of veterans I meet certainly are not. So those are just some, potential prejudices to be aware of.
As nurses, some things to keep in mind as we're caring for veterans: never disregard mental health. Therapeutic communication is about the best thing that you can do for these individuals that have mental health, and acknowledging it and talking about it and making sure they have an outlet and are getting the help and the therapies that they need to cope with those mental health issues that they have. It's also so important to screen for suicide, PTSD, depression, alcoholism, drug abuse, anything like that these individuals could be using to numb the way that they're feeling. Those are things that need addressed and need acknowledged. We need to build rapport with our patients so that they can trust us and we can trust them and understand them and where they're coming from. The things that they're going through, a lot of us can't even begin to fathom. And so it's really important just to have a very open communication with them, understand how best we can help them, things that they're comfortable with, things they're not comfortable with, resources that they can have to help them best cope with their transition home. Not all veterans take advantage of the VA, even though they should, and they need to be connected with those resources. They all have different experiences, and it takes time to know them. So just continuing to keep that open relationship with them, making sure that they feel safe and like they are heard in your care.
And that is all we have. So thank you for listening.